Hello everyone, I hope you're doing well. Today's topic was suggested by Jason H. from Toledo, Ohio. So first of all, thank you Jason for the suggestion. Today I'm going to be talking about a sensation that is often described as ear pressure, ear fullness, or a plugged feeling in the ears, and how this can relate to tinnitus. This is something Jason has been experiencing, so he's interested in learning more. And since this is quite common among people that have tinnitus, I'm betting that lots of others will find this information helpful as well. Now, this is an important topic because when someone has tinnitus, the symptoms that occur alongside it can sometimes give us useful clues about what other conditions may be present. And in many cases, those coexisting conditions may not just accompany the tinnitus, but may actually be contributing to it or helping to drive it. And when we identify and treat those accompanying tinnitus drivers, the tinnitus perception oftentimes improves. So in this video, I'm going to go through 8 of the most common causes of ear fullness, one by one, briefly explain what's actually going on with each of them, discuss clues to identify their presence, and then touch on possible remedies. So first of all, we're going to start with eustachian tube dysfunction, or more specifically, dilatory eustachian tube dysfunction. Now, the eustachian tube is the air valve of the ear that connects the middle ear space behind your eardrum with the back of your nose. This tube is supposed to open and close as necessary, allowing air to travel back and forth between these spaces so the air pressure is always equal on both sides of your eardrum. However, if there is swelling of the nose lining due to things like nasal allergies, sinus infections, or colds, the lining of the eustachian tube can also become swollen, and it may not be able to open when it should. And in these circumstances, negative air pressure can build up behind the eardrum, producing a plugged sensation in the ear. People with this issue may also notice ear popping, crackling, muffled hearing, or discomfort with altitude changes. So if you have nasal congestion along with ear fullness, this is a likely culprit. Now, many people with this issue will feel temporary improvement in their plugged sensation if they pinch their nostrils closed like this while trying to blow air out from the nose, like this. Now, this maneuver can manually open the eustachian tubes and alleviate a pressure difference. But don't force this if the maneuver causes you pain. For my patients with eustachian tube dysfunction, the first remedies I usually recommend trying are an anti-inflammatory steroid nasal spray like Fullness or generic fluticasone, and saline nasal irrigations with the squirt bottle version of the NeilMed Sinus Rinse Kit. If tinnitus develops in the setting of eustachian tube dysfunction, treating this pressure problem can frequently resolve the tinnitus. But as an aside, I'll mention that this condition, eustachian tube dysfunction, is by far the most well known by other healthcare providers. So most people who complain of ear pressure or fullness to their primary care physicians or to doctors in urgent care will be told that this is the source. However, in truth, as you'll see in this video, there are several other causes that can produce a similar sensation in the ears, but that require a different approach to improve. So cause number 2 is also an issue with the eustachian tubes, but it's much less common, and it's called patulous eustachian tubes. And this describes the situation in which the eustachian tubes are actually staying open too often. So it's kind of the opposite problem from the typical dilatory eustachian tube dysfunction we just discussed. People with patulous eustachian tubes typically describe a hollowness or fullness sensation in the involved ears, often accompanied by hearing their own voices more loudly and hearing or feeling their own breathing more prominently in their ears. They may observe that their symptoms are worse standing up than they are lying down. Some people, including myself on several occasions, may experience this problem after exercise. People with patulous eustachian tubes do not typically report nasal congestion, and they don't feel any relief by pinching their nose and blowing like we discussed previously. Patulous eustachian tubes are more likely to occur in people that have experienced a recent significant weight loss. So, interestingly, many ENT specialists have reported seeing this condition more frequently recently among patients that are taking the new GLP-1 agonist medications like Ozempic and Wegovy that we've all heard about in the news. Now, recommended treatments for patulous eustachian tubes include avoiding medications that can reduce nasal congestion, focusing on good hydration, certain nose drops that can plump up the nasal lining around the eustachian tube opening, and even some procedures on the eardrum or the eustachian tube openings. Another common cause is simple ear canal occlusion. Earwax or skin debris can sometimes build up in the ear canal and block it off, creating a plug sensation and sometimes muffled hearing. This is much more likely to occur in people that use Q-tips, wear hearing aids, or have dermatitis of the ear canal skin. Sometimes people with this problem will report a crackling sound or a change in their ear fullness when they move their jaw or chew, because these actions actually change the orientation of the outer ear canal. Usually this problem is readily apparent when a doctor looks in the ear with an otoscope, but removing the obstruction safely often requires the expertise of an ENT specialist who can use special tools while examining the ear under the microscope. So cause number 4 is a related but less commonly discussed problem, which we call eardrum desquamation or retained keratin on the eardrum. You see, the outer layer of the eardrum is made of skin, just like the skin on your arm or on your face. And skin of this type is continuously regenerating itself. As a new layer of skin develops from below, it sheds the outermost layer of dead skin cells in the form of little white flakes. Usually we are unaware of this process occurring in most areas of our skin because these little flakes just fall off. But the skin flakes that are shed from our eardrum have to find their way out of our ear canal, which is about an inch long in most people. Sometimes this process is impaired and a layer of dead skin gets stuck on the surface of the eardrum. This can produce a sensation of ear fullness along with muffled or distorted hearing and sometimes an itchy sensation. This problem may not be obvious to a primary care or urgent care physician looking in the ear with a standard otoscope, so it may not be recognized until an ENT specialist looks very closely at the eardrum under a clinic microscope. But once diagnosed, this skin debris can be gently removed from the surface of the eardrum under the microscope with delicate instruments, usually producing an immediate resolution of the bothersome ear symptoms. The next major cause of ear fullness is temporomandibular disorder, or TMD, which is very common and frequently overlooked. People with this condition have problems with the jaw joints, also called the temporomandibular joints, or they have excessive tension in the surrounding chewing muscles here and here. This problem is frequently predisposed by stress or certain medications that promote overactive jaw clenching behavior. Because the jaw joints and the chewing muscles are located immediately adjacent to the ears, problems with these structures can be experienced as ear symptoms, often including ear fullness or pressure and tinnitus. Clues that may suggest TMD include tenderness along the jaw joints or the chewing muscles, or perhaps tightness in the chewing muscles observed as a resistance to mouth opening, or observations by your dentist indicating trauma in your mouth from teeth clenching or teeth grinding. Now, some people with this condition even report the ability to modulate their tinnitus by moving their jaw or pressing on the muscles around it. Once identified, symptoms from TMD can often be improved with stress management strategies, focused physical therapy, and custom oral appliances fashioned by a TMD specialist dentist. Another common source of ear pressure is atypical migraine. Now, many people think of migraine as just a headache disorder, but migraine can actually cause a variety of other symptoms in the head and neck area. In fact, you can have an atypical migraine disorder without having headaches at all. Many people with migraine experience fluctuating symptoms of ear pain, ear fullness, tinnitus, sound sensitivity, and dizziness or vertigo. Usually there is no clear explanation for their symptoms on physical exam and ear testing, so their symptoms are too often dismissed by healthcare providers. Classically, their symptoms vary in severity over the course of a typical week and can be exacerbated by factors like stress, sleep deprivation, weather changes, diet, and hormonal shifts. As this condition often runs in families, our suspicion for atypical migraine is heightened if there is a family history. Many people actually report a personal history of more classic migraine headaches when they were younger that seem to resolve, only to be replaced later in life by more atypical migraine symptoms, like ear pressure and tinnitus. Unfortunately, there is no definitive test that will confirm the diagnosis, so we frequently have to rely on an individual's description of their symptoms and to rule out other potential causes. But if we suspect that migraine may be contributing to ear symptoms, recommended treatments include environmental and dietary migraine trigger reduction, certain nutritional supplements, and daily preventative migraine medications. Another possible but less common cause of ear pressure is called Meniere's disease. People with this condition experience fluctuating hearing loss and tinnitus in the involved ear, along with episodes of spinning vertigo that typically last between 30 minutes and a couple of hours. The tinnitus is often described as roaring and frequently gets much louder immediately prior to a vertigo episode. Most commonly, the symptoms are more prominent in one ear rather than the other. The cause of Meniere's disease is controversial. Some experts feel that it's caused by a problem with the regulation of pressure in the fluid compartments of the inner ear, while others think it may actually just be a variant of migraine. Certain patterns of hearing loss on a hearing test can also be more suggestive of this condition. The most common treatments include sodium, alcohol, and caffeine restriction, daily diuretic medications, and intermittent ear injections with anti-inflammatory steroid medication. And finally, certain patterns of hearing loss can actually themselves create a sensation of fullness, regardless of what's actually causing the hearing loss. More specifically, conductive hearing losses in which there is some factor interfering with sound transmission from the eardrum to the inner ear, and low-frequency sensory neural hearing losses can be associated with this sensation of the ear feeling plugged. This can only be diagnosed based on the hearing loss pattern on a formal audiogram and after ruling out other potential explanations for the symptoms. The cause of the fullness sensation in this setting is really not well understood, but it likely involves the way sound input is being processed and interpreted in the brain. Sometimes treatment of the hearing loss in this situation can reduce the sensation of ear fullness among individuals in this group. And others seem to gradually habituate to the sensation, so it becomes less apparent and bothersome over time. So those are the 8 most common causes of ear fullness or pressure. There are a couple of key messages that I'd like you to take away from this video. First of all, the sensation of ear fullness is not always caused by eustachian tube dysfunction. There are a number of other potential causes that really should be explored. And secondly, if you are a person suffering with a combination of ear fullness and tinnitus, identifying the cause of your ear fullness can be very helpful because often treating any secondary issue contributing to the ear fullness can reduce the severity of tinnitus as well. So thanks again to Jason H. from Toledo, Ohio for suggesting this topic. I hope you all found the information helpful. Please remember to like this video and to subscribe to my YouTube channel, and feel free to use the comment section below to ask questions, give me feedback, or suggest other video topics. See you next time.